I am a urologist and pelvic surgeon, and today we answer a very straightforward question. Do women really masturbate? If you're new here, I am a urologist and I make educational content every Monday and Friday. So if you like what you see, make sure you share this with your friends. So many of you may think that you know the answer to this question, but I am gonna show you some data that says otherwise. And in fact, a lot of people are actually surprised by how often women actually do masturbate. In this video, I'm going to review the prevalence of female masturbation, what the most common methods are, what types of orgasms women typically experience during masturbation, and lastly, can masturbation cause any problems in women? If you're interested, make sure you stick around till the end. So the first thing I want to look at is how often do women masturbate? And there have been studies done looking at exactly that. This study was published in 2016. They surveyed over 2,000 women from different parts of the world, and they asked them essentially, do you masturbate? And they found that about 78% of women reported that they did masturbate at least once in their life. And when they looked at it across age groups, younger women were more likely to admit that they masturbated compared to older women. However, when they looked at it across different regions, women who lived in more rural areas or less developed countries were less likely to admit that they masturbated. Another study, which was done in 2019, they surveyed over 3,000 women. This was specifically in China, and again, they found that 2/3 of the women admitted to masturbating at least once in their lifetime. And when they looked at it across age groups, those between the ages of 21 and 24 were more likely to admit to masturbating compared to those who were above the age of 50. Interestingly, when they looked at it across regions, women who lived in urban areas were more likely to admit to masturbating. And the reason for this, they theorized, is that women in urban areas have higher levels of education, higher incomes, and thus are more likely to feel comfortable admitting to something that previously may have been taboo. And then another study looked at over 4,000 women, and they found that 82% of women admitted to masturbating at least once in their lifetime. So clearly, across all these different studies, the numbers are very similar. The big thing to take away is that a vast majority of women do masturbate at some point in their lives. The next question is, how do they actually do it? In a study looking at almost 3,000 women, they asked them, what do you typically use when you masturbate? About 75% of women said that they used their hand, 15% said they used some sort of object like a vibrator or a toy, and about 6% said they used their mouth or their tongue. And when they looked at this across age groups, there was no significant difference. However, when they looked at it across education levels, women who had a higher level of education were more likely to use toys or objects during masturbation. Also, women who lived in urban areas were more likely to use toys or objects during masturbation. The next question is, what type of orgasms do women typically experience when they're masturbating? And this was assessed in a few different ways. So in one study, they asked women to rate their orgasms during masturbation based on several different characteristics. So they could pick multiple things that applied to them. And the most common type of orgasm that women reported was something called the G-spot orgasm, and 69% of women said they experienced this. About half the women said they experienced an intense sensation in their lower vagina or their About a quarter said they experienced an intense sensation in their clitoris, and about 13% experienced a vaginal or pelvic contraction. Some also described other sensations like an intense spinal or abdominal sensation. And interestingly, when they looked at it across age groups, younger women were more likely to describe their orgasms as intense, whereas women over the age of 50 were more likely to say that their orgasms were long-lasting. So that leads me to the last question, which is, can masturbation cause any problems in women? And in general, for most women, masturbation is perfectly safe and healthy. In fact, it has some benefits. It can be a way to attain orgasm, which has many benefits for your health, including reducing stress and increasing relaxation. It can be a way to learn about your body and learn what you like and do unlike so that you can better communicate that to your partner. It can be a way to increase self-confidence and it can be a way to reduce arousal non-objectively, so that you're not fixated on appearance or performance. And finally, it can be a way to reduce sexual dysfunction. However, there are some risks to masturbation, and I've talked about this before in my video about masturbation in men, where too much of anything is a bad thing. And in fact, there is such a term for this, which is called masturbation as addiction. Although this is not recognized by the DSM, which is the handbook that we use for psychiatric disorders, there are some people who can become addicted to masturbation. And I've made a video previously about how to break a masturbation addiction. Also, some women may complain of pain during or after masturbation, and this can be due to a number of reasons. It can be due to lack of lubrication, which can lead to micro tears or small tears in the vaginal skin, or it can be due to using something that's too large or too rough for the vagina. And in fact, the vagina has a normal microbiome, a normal set of bacteria that live in the vagina. And if you're using certain products or materials that are not friendly for the vagina, you can disrupt this microbiome, leading to what we call bacterial vaginosis or vaginal infection. Similarly, if you're using something too rough on the vaginal skin, you can cause small tears in the skin, leading to bleeding. You can also cause injury to the clitoris or the urethral opening, and that can cause discomfort or pain during sex. And rarely, you can even injure your bladder and have what is called a bladder perforation or a hole in your bladder. But this is extremely rare. Signs that you may have caused yourself some sort of injury through masturbation include having difficulty urinating, having pain when you urinate, having vaginal discharge or bleeding, having pain during sex, or having pain in the lower part of your abdomen. If you have any of these symptoms, make sure you go see your primary care doctor or urologist so we can evaluate you and make sure everything is okay. Bottom line is, for most people, masturbation is a normal, healthy and enjoyable experience. And in fact, it has some great benefits. However, like anything, if you do overdo it, you can cause yourself some harm. So hopefully this answered your questions. As always, remember to take care of yourself because you're worth it.